So the other one is the non-status and the Inuit. So the colonization is almost like what I call the tossed salad. So when colonization happened, everybody was, we were just tossed everywhere, and we ended up where we ended up, and it's, it's just the way it is. And some of our people we were even adopted, and they ended up overseas, over in England, and that, I hear stories about that, they end up in the States. So we're on different paths of recovery and healing. So the vision that I picked up along the way, that I've been working with and nurturing, is to utilize the land as a means to revitalize the Anishinaabe tradition and culture. That's the vision. I've been nurturing that and developing it, and I practiced it over the years. Out in Thunder Bay, when I worked out there, I worked with the Sheboygan Health Authority. For 3 years in a row, I worked with youth. I brought them out to this camp. The first year was a little rough. Second year was better. The second year was, it was so amazing the way that happened, because it takes me back to this young lady named Stacy. She's from Sandy Lake. Get this, she was a high school student, and I was an instructor. I took the Anishinaabe Askies to 10 of those youth who were just getting out of high school. They were in grade 12, 13. And I took them in the bush and spent a week with them, and Stacy was one of them. And so, yeah, okay, and then we went on our way. And years later, I kept in contact with Stacy. And next year, she got her outdoor rec, and she was working in her community. And I said, "Hey, Stacy, you want to come work with me at this camp?" She was my co-director for this camp, and looking after all the girls, because it is very real that, that there's a safety aspect in regards to girls feeling comfortable with males and females. So she came and helped me out. And so to this day, Stacy is, she's a nurse now out in Thunder Bay. And so she's quite a role model for her community. She only, she's a little Stacy. But anyway, so this is all evidence-based in regards to this content that I'm talking about. Stacy, she went through the program, and she's develop that context, being able to do something with herself. And of course, her background is her parents were separated. Her father lived in Hamilton, and her mother's up in the community. She lived with her mother. And yes, I spent some time with her, and I did some counseling with her and supported her well, so it's all part of that relationship. So these kind of connections are very lifelong kind of things that go along with this, in terms of that kind of commitment and realizing. And this was back in, what year would that be? That would be the year 2001, I believe. Yeah, year 2001. So it was very real in terms of that. And then Stacy came back into my life back in 2005 when I got that program going through Sheboygan Health Authority. It was a camp up north of Pickle Lake called Crystal Lake. And so I brought all these kids together from all these different 5 communities, and there were like maybe 30 of them. And I had chaperones from each community. And I got together with those chaperones before we actually got together as a camp, and I trained them a bit in regards to preparing them as to how we're going to work with the youth who come to that camp for safety reasons. So we're able to have a safe experience. So these are all the different kind of things I learned when I worked at Outward Bound in terms of setting things up to make sure we have a safe experience. That's the whole idea of why Outward Bound still exists today, because of their policies, procedures around safety.